Welcome to the Earned First podcast. My name is Arun Sudhaman. I'm founding editor at Earned First, and I'm very lucky to be joined today by Gil Bashe, who's the author of Healing the Sick Care System Why People Matter. Gil is also chair of health and purpose at Fin Partners, advises healthcare organizations globally. Fin, of course, is a US headquartered firm, but is increasingly active across Asia Pacific, now expanding into the Middle East. And Gil is with us here in India today, visiting Hyderabad. Gil, welcome. How's your trip going so far?
First of all, thank you very much for the gracious welcome. And I'd like to believe that my major focus, of course, is on Fin Partners and its mission. And also, I've authored a book. So I'll just flip your intro for a second. The visit is going extremely well for many different reasons. One, as you know, and you've been a long supporter, and I thank you, we're a major presence in India with
Mhm.
offices throughout the country and representing, of course, many of the world's great life science companies here in India. There's an increased interest in this market for many good reasons. India has an incredible policy infrastructure supported nationally and regionally. Hyderabad has really become a mega center for technology. It's India's high tech city, and as you drive around, and I'm sure you've been here before, you really see the influence of multinational companies on this
Mhm.
city. Establishing their headquarters, companies like Novartis, which have about 9,000 employees in India, they're not just focused on India, they're focused on actually supporting Novartis around the world. And this is just
Mhm.
one example of many of the world's great life science companies that have come to this city and to India. So it's a great visit. I get a chance to hear moment by moment incredible accolades about our work with SPHE Fin in this market. And
Mhm.
as someone who's very passionate about this work, it's always very reassuring when people pull you aside and are raving about your colleagues. There's nothing sweeter to hear, my friends. So it's been a
Mhm.
great visit, a busy visit, and yes, the book here in the city has has been a surprising hit of how word has reached people here in the industry. I'm getting direct messages from people. Also, there's been a major feature about the book in the city's newspaper. So I don't think I can put a disguise on when I leave my room so I can get to the meeting. I don't think it's that popular, but it's touching people's hearts here, and that I'm grateful for. So thank you.
It's great to hear that, and we will talk about Fin Partners a little bit later on. But let's talk about the book first. You were kind enough to share some excerpts with me, which I'd read, and of course, the focus to some extent is on the U.S. healthcare system, but the themes I feel are universal. Um, and one of those themes is that healthcare institutions command enormous authority, but they are challenged by declining public confidence in them. And I think that's a global theme. And so I wanted to start there. Why do you think healthcare is struggling to sustain that institutional credibility despite such an important life saving role?
Yeah, it's a number of reasons. I wish I could say it's this one reason and we'll
Hmm.
fix it. Um, Let me just say, everyone in the health system, no matter what element you represent, whether you're a government payer or a private payer or a physician or physician specialist or a nurse or pharmacist or a, technical staff in the health system, whether you're involved in product innovation or patient advocacy or policy, everybody wants the system to deliver for the people it seeks to serve, in theory. What happens is that in between the desire and the application of health, we've become a process driven system that's transactional. How much does it cost? How much do you get paid? How much is it reimbursed? Who pays for the reimbursement? And so that middle part actually has disrupted the historic relationship between the healer and those people who are seeking to be healed. And that disruption has become so vast that people feel separated from the system itself. So when you look at a doctor in in this city, and I met with quite a few, They are, when I say to an orthopedic surgeon, um, what's your specialty in orthopedic surgery? Somebody might say hip or
Mm,
rotator cuff or knee. And so as medicines become more specialized, doctors suddenly channel their ambition not to you or to the person, but your rotator cuff. And the relationship becomes about the it within you rather than the whole you. And
mm,
that's not why people got into medicine when they first entered into the field. It was actually they were pretty passionate about healing people. Over time, when they have to justify the cost and their time and their continuing medical education, suddenly they become less interested in why they got into medicine and surviving medicine. That's on the professional side. On the consumer side, uh, we realize that our voices actually are minimized. Our experience, how
mhm,
many people go into the doctor? You might do it, or one of your colleagues might do it, and come in with some online printouts, whether it's OpenAI or Google, whatever the case might be. And you go into the doctor to ask some questions, and you have sheets of paper in front of you. And they immediately look not at you, but at the sheets of paper, and they gear themselves emotionally, ready to argue back of, don't believe Dr. Google, believe me. I've even in the book, I cite one instance where a doctor said to my face, as I'm with a patient who happened to be my daughter, is my daughter, the doctor said, who are you going to believe, me? Who are you going to believe, me or a patient? That little vignette is in the book. And try to think about my daughter's experience in the room. She was the patient. The doctor is saying, I don't believe you. I believe
mm,
only me. Medicine is a relationship, and the book's global theme, and thank you for mentioning that, the global theme is essentially we've got to rebuild a health system that remembers our humanity. And,
mhm,
you and I come from the precious discipline of communication. I mean, you're an ambassador for our discipline, and I thank you for that. But try to imagine that the system stops communicating with, I don't say to, with
mhm,
the people it seeks to serve. We start to feel marginalized. And that's what's happened globally. More and more,
mhm,
it's happening. Now, interestingly, and I compliment the Minister of Information Technology, who I met with twice while I've been here. He said to his audience, we have to build in this country, India, we have to build a system that is compassionate and caring and considers access and deals with not only those who are prosperous, but those who are struggling to rise to prosperity. For a
mm,
policy leader to say that distinctly represents a certain sense of self awareness of what is the responsibility of the system.
mhm,
So it ties back to the original question of how's my visit going? And I
mm,
would say I am inspired by the mindfulness of the state government of India here in this state and in others. Where I had a chance to hear from them directly.
mm. Indeed, I think sometimes there is a greater focus on health equity in perhaps in countries where there's more balance across all the different actors in this equation. But it's interesting also that you mentioned the importance of believing, of belief, and you write about that as well. And it seems to me that often the institutions we talk about, whether it's payers or whether it's healthcare systems, um, have been optimized more for compliance, for efficiency, for risk management, rather than patient belief. And again, this is not an easy question, but how do we shift that so that we reach a situation where patient belief perhaps is taken as seriously as these other factors?
Yes. So historically, in a pre information curated era, we chose physicians and other health professionals by their IQ. I look at my father-in-law, who I mentioned in the book. He passed 3 years ago, but he graduated from medical school at 21. He was a genius. what we categorize as a genius. He had
Mm,
three medical specialties and board certified in three aspects of medicine. I mean, he was really that passionate about it. But one of his great superpowers was almost complete retention of information.
mm,
And so, if we look at some of the great physicians of the 50s and 60s and 70s and 80s, they not only had great clinical skill, they had great memorization of data. They were walking open AI human machines.
mm,
That made them. Now, if they could combine that with humanity, a sense of personality, a sense of retaining their passion for patient care, they became medical superstars. They had the
mm,
whole package, right? They had the skill and they had the connection to the people they were trying to help. And
mm,
that's what made them rise to the top of the system. Now into the information age, and suddenly and specialization, new innovation that drives clinicians to say, I no longer just deal with orthopedic surgery in general. I only do hip replacement. Or
mm,
I'm not a gastroenterologist. I focus on upper GI disorders. Or I'm not a neurologist. I only focus um, on particular illnesses. And
mm,
so as medicine moved to the specialization, it started to separate more and more from its humanity. And
mm,
so the prospect is that none of our pieces of the health system actually share a common metric, if you think
mm,
about it.
mm,
Doctors have a different metric than the government. The government has a different metric than insurance companies. Insurance
mm,
companies have a different metric than health innovators, biopharmaceutical companies. They don't
mm,
share an economic system. They're not aware of the supply chain of cost, and they're measured by their stakeholders differently.
mm,
They have to share a common metric in order to feel part of an overarching care community, and that
mm,
is us, right? They have to look at their impact on us, and the
mm,
closer you are to the human being side of this, the easier it is to say, what's my impact on that person's life?
mm,
And so the, the the panacea from all this was we have to rebuild a system that in fact remembers why it was created for the sake of humanity
mm,
instead of for the sake of what's the shareholder value for this quarter and how many billions did we make in profit. That's an outcome of great work. It's not the goal of the work. The goal
mm,
of the work is to focus on people. If we focus on people, in theory, and we do that very well, money should follow consistently. I mean, right, we'll be
mm,
valued. So I look at this. So you've been covering my sector of health communications for decades, and I thank you for that. The When I entered, it's hard for me to say it, 4 decades ago, the whole thing was the focus of news was inventing medicines that created a life-saving difference, that
mhm,
kept people alive, that overcame heart disease, that sought to push back cancer, extend life, survival, push on survival, to take people who had mental health concerns and make their lives better. And that's how we drove the news initially because it was real. And now we talk statistically. How many patients are impacted? What's the cost? All that. That's important, but it's not the dominant factor. I think the dominant factor is care about you, and and got to get back to that.
absolutely. The backdrop, as we've mentioned here, is not just declining confidence in healthcare systems, but in institutions in general. I think whether it's government, whether it's corporations, and one thing that you often hear is that more transparency is required to reverse that trend. Is that enough?
No, it's not enough. I do believe in transparency, timeliness to build trust. I do believe in that. I think when you're transparent and you're timely about that, you're not forced into transparency, and you should build trust. But one of the aspects I believe, and I indirectly covered in the book, I do highlight certain people I've encountered that buck the system, not intentionally. Their behavior is unique to their belief system and personality as leaders. And as a result of that, you trust them most certainly. You believe in them. I cite people like you've probably encountered either personally or in the news people like Roy Vagelos of Merck, who
Mm,
donated ivermectin, the drug, to overcome river blindness. That was the scourge of many nations. Now it's almost eradicated around the world because of Dr. Vagelos's decision. Or Ken Frazier, who made some very bold decisions during his tenure of Merck. I cite them. I cite some incredible doctors. I have the privilege of speaking to world class doctors and working with them who will take a call from a patient late at night, and and they don't even know the person, but they know the
mm,
person is worried, and they make the time. They're passionate about helping people get better, and I
mm,
cite those by name. Now, those that I felt fell short of the mark, I don't mention by name, and I don't mention their institution. I mention the instance to just create the dichotomy. I think we have to applaud those people, those leaders that are putting themselves out there. Let me talk about our profession for a second, communication and thought leadership. What is thought leadership? It's not visibility, and it's not just the amplification of voice. It's influence. And we
mm,
sometimes think thought leadership is about projection of self.
mhm,
It's really about saying I respect that person, and as a result of that, I I attribute what they're doing to their enterprise as well. And so
mm,
a lot of senior leaders of our health industry seek to project news about the company. The company is the star,
mm,
but let's face it, you cover companies, you cover, let's say, agencies or
mhm,
companies that have communications departments, but actually, don't you think the candor, transparency, engagement, connection to the market of the leadership is what makes you feel an affinity for the company or its ability to navigate a difficult circumstance? It's
mm,
not just what the company does, it's what its leaderships commit the company will do. So
mm,
I kind of try to channel that in the book. There's two things consistent in the book that have, I think, framed my and Finn partners' belief in great communication. One is collaboration, when people are willing to work with people across the aisle. And the other is communication. In my introduction, I cite the story, if you remember, of Apollo 13,
mhm,
the, the spacecraft that almost didn't come back home. It was on its way to the moon. The mission shifted to sort of say, after an explosion inside the capsule, how do we get these people home alive? Oxygen system was depleting. Power was depleting. Navigation was depleting. They had to retreat from the ship into the capsule that would bring them back to Earth. What wasn't destroyed was the communication system. Without that
mm,
communication system, they would have died in space, tragically, horrifically. On Earth, what made it work? They brought a batch of people from different disciplines who knew the capsule well into a room, and they had to collaborate. And so the combination of communication and collaboration brought three heroic, brave astronauts safely home again. And
mm,
so I seek to sort of say we need to apply that to the health system right now. We can communicate with each other, and we can choose to collaborate with each other.
mm,
Payers and doctors have to learn to collaborate. Payers or doctors often cite the fact that they spend 2 hours a day arguing with payers about prior authorization, and they feel
mhm,
burnt out about it. 2 hours a day. We know we have to help that person. What's the game plan? We have to collaborate. We have
mm,
to share responsibility for that person, not just the economics around the person. So I do
mhm,
touch on, and I believe that deeply. And it's probably one of the reasons why, since you've been watching Fin Partners, we've risen to be one of the great communications agencies in the world today. Our
mhm,
behavior sets the client up for success.
mm. Are you surprised by the depth of rage that exists now? You talked about prior authorization. That seems to be um, an especially triggering phrase these days, particularly in the US. We've seen protests. We've even seen quite tragic situations unfolding.
Horrific
Um,
murder, horrific murder of
yes,
Brian Thompson. Yes.
the murder of Brian Thompson, the United Healthcare CEO. Um, it indicates a depth of rage towards insurance companies, and I wonder if is it as simple as collaboration and empathy to solve a level of anger that seems beyond anything we've seen before.
So I do write about that in the book, and I've written about
Mm,
that situation privately at the request of magazines.
mm,
When, first of all, murder is murder.
mm,
There's no justification for murder, period.
no.
But when
Hmm.
we examine the situation itself, and we realize that that the murderer Luigi um, developed sort of a fan club, and he's raised $1 million on crowdsourcing for his legal defense. It's not a question of how many or the magnitude of people that are sympathetic toward him. It's that there are people who are sympathetic toward him.
Hmm.
And
Yeah.
so insurance companies have to step back and say whether we're doing the right thing or not, we're
Mm,
painted by the same brush right now. And we have to rethink our relationship with what they term beneficiaries, but
hmm.
they're customers. Customers are angry at them, or upset, or frustrated, or frightened. Now, part of it is I get letters from my insurance company. I won't mention them, but I think I understand the English language relatively well. And I certainly understand health relatively well if I don't understand the English language. I cannot make heads or tails of these letters at times. I don't know
Mm,
if they were written by a lawyer who didn't take English 101, or someone just whipped them out, or they have their poor use of prompts in OpenAI, and they've been written by a large language model that was going amok. But I get letters such as my daughter who has a rare disease. We get letters a year and a half after a medical procedure asking us to explain to the insurance company why a neurologist was present during a surgery and to provide the medical documentation. Um, Certainly, my daughter, who was under anesthesia, doesn't know that there was a neurologist available, and
mm,
I do not have medical records. Probably it's better directed to the provider than me.
hmm.
However, the letter is certainly directed to me as the policyholder, and I say to myself, "Gee, if um, if that was Nordstrom writing to me, a clothing store in the United States, asking me to explain why the bow ties I wear have been defective for a segment of society," I would say, "Don't you think you should address this to Nordstrom's instead of me, the person who bought the bow tie?" It's run
Mm,
amok, and I think insurance companies have to sort of say, we need to train everybody on customer service. We need to train that when people call us who are dealing with life concerns, they're anxious, and we're making them more anxious, and our job is not to do that. And if we want to do prior authorization, the best medical practice, we need to have a better explanation of what we're doing in terms of managing care rather than
mm,
delaying care. So I do think there's a huge need for internal communications. I think there's a need
mm,
for external communications. I think there's a need to set down goals of what the relationship should be like between the company and the people it serves, its customers. And so the
mm,
book sort of examined those situations from the point of view of how do we emotionally feel about this? Now,
mhm,
as an agency, we sometimes look at tools or tactics, but I think that I have the highest regard for my colleagues here. And I mentioned being here in India with SPHE Fin. When I hear the sensitivity that they deploy in terms of the holistic relationship between the company and the people it seeks to serve, I
mm,
feel inspired and reassured. Same within the United States. They're thinking not just about representing the company's interests, but representing the company's connection to the people it serves. And that includes
Mm,
shareholders, by the way. That includes policymakers. That includes insurance companies. But it includes patients and caregivers, not as an afterthought, but as a primary initiative. And that's what we need more of in our industry. We're a little
mm,
off course right now. And the book acknowledges that. And I get letters and calls and DMs on LinkedIn from people thanking me, um, thanking me for putting it straight. Actually, someone wrote a big review on Amazon that I don't let anybody off the hook, but they also say that's true. I don't. And if people know me, I don't let myself off the hook even. But
mm,
they also write, I leave everyone hopeful that we can do something about this pretty darn quickly, and
mm,
that's my intent also. It's not a broken system; it's a system that needs more self-awareness.
mm. So, Gil, one other thing I wanted to ask you about, and your responses now, some of the things you've said, they kind of, to me, indicate that the level of skepticism that we're seeing um, isn't just a matter of ignorance, but in a way, it's kind of behavior that people are learning. Um, and if you take that as as the context, the rise of health influencers is something that we're seeing, every day. Um, their influence grows. Are they filling an information gap or are they exploiting a trust gap?
Both.
Mm,
It's not one or the other. They are people like, let's say, Matthew Zachary, who actually
mm,
endorsed this book. Um, I saw it for its true intent. He was the creator of the organization Stupid Cancer when he was diagnosed with brain cancer during his college years, and he's been on the cover of Newsweek. He's certainly a major influencer. He has a great book coming out. Actually, I guess not spoiler alert, but preview alert. But I had a chance to read the manuscript. It's great. I mean,
mhm,
absolutely. It's a well needed book. His rise in popularity is because people do want champions out there. So
mm,
we call them influencers. I think he's a champion for patient voice. The patient
mm,
needs more equity in the conversation. And people like him and others are going to do that. So the rise of influencers are because we feel we need advocates who have
mhm,
clout. So
mm,
and that's needed because the system is starting to marginalize the patient more and more, and
mhm,
it's actually elevating the system. We need balance, and I think
mhm,
influencers like that create balance. I don't think it's a question of lack of distrust
mm,
or lack of belief in the system. I think people hold innovation in very high regard.
mm,
I think that they want they want the connection between the innovation and what does it mean for me? Why should I care? To be clearer in language that speaks to their needs, and that's
mm,
why influencers are rising. So, I think that we have a number of people out there who I look forward to seeing. I look forward to hearing from, and I think that when I speak to my daughter, for instance, about her health journey, I learn. I feel inspired. I also
mhm,
feel worried and sad at times. But that's the range of human emotions that influencers bring out in us. So I think it's needed. But I don't think it's out of distrust. I think it's
mm.
because we've long neglected the voice of the consumer, of the patient.
Indeed, yes. Influencers, I guess, feel more human, more accessible, more in line with people's experiences. In this part of the world, one observation is that community voices sometimes carry more legitimacy than formal systems, institutions. But the risk, of course, is that they're not operating to the same standards. How much does it worry you that influencers may legitimize misinformation?
Well, it's a very big concern. And certainly when we look at AI and we think that AI is infallible, actually 71% of medical information curated isn't accurate.
Hmm,
And often the consumer may or may not have that knowledge.
hmm,
So obviously, health professionals play a very critical role in not dismissing that information, but in clarifying it. And
hmm,
I think that's very but influencers. like a Matthew Zachary who've lived through the experience, um, actually are experts. They're experts in their journey. You can't discount their journey. And so it helps us. If you were to buy a house or a car or a washing machine, you might speak to someone who bought that model, bought in
Mm-hmm.
that neighborhood. It's the same thing with a patient. They've kind of had to buy in without the desire. Nobody wants to be in a hospital, but they had
Mm-hmm.
to buy into the experience. And their sharing that experience helps us create context. And that's why they're
Mm-hmm.
so. I would say, I just want to point out something. I write about Dr. Mike Rosenblatt, who was Merck's first chief medical officer in the book. I have great regard for Mike. Um, he went on to be chief medical officer of Flagship. He's now a consultant. He serves on many boards. He was born in a displaced persons camp. Um, and his parents came to the United States as refugees, as immigrants. And that experience, that childhood experience, has colored his perspective of what it is to be a doctor, to be a healer. He's very
Mm-hmm.
accessible. He talks about how his daughter almost died in childbirth. He realizes with all his might and connections, he's vulnerable, he's human. That's the essence of all this. Whether
Mm-hmm.
you're the CEO of one of the world's largest health companies, pharmaceutical companies, or whether you're a doctor in rural India, it doesn't make a difference. We're human,
Mm-hmm.
we're finite, we're
Yeah.
on a journey. We have to remember that humanity to humanity connection in order to do effective work. When
Mm-hmm.
companies view themselves as universes rather than as conduits to healing, they get a little off course. We've got to
Mm-hmm.
get everything back on course of saying, hey, why do I exist? I exist to serve. I exist to serve people who have needs.
Or indeed, whether you're a healthcare communicator, how do you hold on to that humanity as you build Fin partners, for example, across Asia Pacific, across the Middle East?
Well, first of all, culture is critical. I give a big tip of the hat to Peter Finn, who established Fin Partners on the basis of 7 values that are critical to our operating nature and the decision making process. And Peter cares deeply about that, and he's representative. He's a model for those values, and he's a role model for all of us. He's a mentor. So that's one. You have to do it by culture. Now, often having been, as you know, in the big holding companies myself, and being a CEO of one of the holding company's bigger enterprises for some time, what happens is as leaders, we get very much into reporting and making sure the balance sheet is accurate and our
Mm,
lives center around the balance sheet as opposed to the role of health communication in protecting and saving people's lives. Peter is
mm,
very mission oriented. If you look at, if you said, why are you doing Fin Partners, for instance, he'd say, well, I want to create a global community that has a heart and a conscience that could serve
mm,
major governments everywhere. A heart and a conscience. He didn't say, I want to create a global communications company that has X amount in revenue.
mm,
That's an outcome. He knows that. So you have to have leadership that's clear of why the enterprise exists, and does the enterprise make a difference in the world? I'm very passionate about what I do, but I'm also very passionate about where I do it from.
mm,
And so when we bring aboard people like Aman and Shivani Gupta, who lead SPAG Fin in India and now are looking toward the Middle East, there's a cultural harmony that exists that makes us exponentially stronger. And
mm,
I've listened to recently, I attended a seminar on selling your agency, what matters.
mm,
Very impressive presentation. What matters is the balance sheet, free cash flow, opportunities for growth and revenue. I listened to all this and I pinged Peter afterward and I said, you should see this tape. It's interesting. Peter talks about what's his priority. It's culture. It's
mm,
about sharing values. It's about how they treat their people. It's
mm,
about the sense of helping people grow. It's about how do they serve their communities. It's a different mindset. And
mm,
people would say, hey, how can that work? Well, guess what? Um, we're not experiencing layoffs. Um,
mm,
we don't have turnover of staff. We don't have turnover of clients. Uh, what's wrong with our model? It's a pretty darn good model. And I
Mm,
think people feel inspired because they feel, whether you're in travel or education, whether you're dealing with consumer marketing goods, whether you're dealing with technology, regardless, or health, regardless, we seek to impact the world in positive ways. And I think that really speaks to the generation that's entering to our field right now. I think
mhm,
that generation that will lead us forward isn't really thinking about how big we are. I think they're thinking about how good we are to the world.
mm. And at a time of sustained consolidation, I suspect these lessons could not be more topical. Gil, you have been a wonderful guest on the podcast. I thank you for your time. I know
My pleasure.
you must have a busy schedule in Hyderabad today,
I
but
have an exciting schedule today. I return to BioAsia 2026, the 23rd gathering of the
mm,
world community here in Asia, to talk about the biosciences. And again, it's a privilege to see, I did not know it, it was a privilege to see Finn Partners amongst the sponsors of this great gathering. And again, I thank my colleagues in this market for making that possible.
mhm. Thank you so much, Gil, and safe travels.
Thank you, my friend. Thank you so much. Same to you.